The ketogenic diet, or more specifically, therapeutic nutritional ketosis, has the potential to help a range of psychiatric symptoms from bipolar disorder, schizophrenia, severe depression, anxiety, OCD, PTSD, and more. And what's surprising to many is the fact that doctors have used therapeutic ketosis for over a century to treat treatment-resistant seizures. So let's get into the details of why this is important and how it translates to mental health. Welcome back to Metabolic Mind, where we're working to revolutionize the treatment of mental illness by providing information and resources at the intersection of metabolic health and mental health. I'm Dr. Brett Scher. Metabolic Mind is a nonprofit started by Roblox founder David Baszucki and his wife Jan after their son Matt sent his psychiatric symptoms into remission with a metabolic intervention called nutritional ketosis. Our goal is to help families like theirs learn about this new approach to treating mental disorders and to offer a message of hope. Freedom from the burden of mental illness is possible. Now, as we've detailed in our prior videos, the scientific evidence in this field of metabolic psychiatry is ongoing, and there are numerous examples of personal experience and clinical experience from physicians suggesting that nutritional ketosis has the potential to significantly improve psychiatric symptoms. So there's definitely the suggestion that therapeutic ketosis could be a powerful add-on treatment to conventional psychiatric care. But we must be honest that this may be one of those areas of medicine where enthusiasm and experience are ahead of the emerging science, but the science is catching up. But that's okay. That frequently happens in medicine, and that's how fields grow. But what's interesting about nutritional ketosis for brain disorders is, depending on how you look at it, we could also say that it's not new at all, that there's plenty of scientific evidence. In fact, there's over 100 years of experience in using nutritional ketosis as a brain intervention in treating children with treatment-resistant epilepsy. That's right, doctors have used the ketogenic diet for over 100 years to reduce or even completely resolve seizures in children with drug-resistant epilepsy. That means they were tried on multiple medications and not improving. But when they started on a ketogenic diet, many experienced significant improvements. But it's not just clinical experience, right? We have decades of randomized controlled trials and meta-analyses demonstrate a benefit for most patients. Now, I find that pretty amazing in itself. I mean, individuals whose seizures are not controlled by medications can get control or completely resolve their seizures by starting a ketogenic diet with therapeutic nutritional ketosis. I mean, that's an unbelievable improvement in quality of life. But how does this translate to mental health? Well, it turns out there are many ways it relates. So in this video, we're going to hear about those in detail with interviews from experts like Dr. Chris Palmer, Dr. Julie Milder, and dietitians Beth Zupek-Kanya and Denise Potter. Together, these experts represent some of the broadest experience we have in using therapeutic nutritional ketosis, both for epilepsy and for mental health. And near the end, we'll define the specific types of ketogenic diets that may work. Does it have to be the so-called 4-to-1 strict ketogenic diet used early on in epilepsy? Or can the more modern, flexible ketogenic diet work just as well? We'll get to that in detail so you know how it may apply to you. But first, some important clarifications. Our channel is for informational purposes only. We do not provide individual or group medical or healthcare advice or establish a provider-patient relationship. Many of the interventions we discuss can have dramatic or potentially dangerous effects if done without proper supervision. So consult your healthcare provider before changing your lifestyle or medications. Therapeutic nutritional ketosis, or simply starting a ketogenic diet, is a powerful health and medical intervention that can change your body's metabolism and can alter brain function, medication levels, sleep patterns, energy levels, and other physiologic functions. You should not start a ketogenic diet alone if you have a psychiatric diagnosis or symptoms or take a psychiatric medications. Instead, you should only consider starting a therapeutic ketogenic intervention with careful monitoring from your healthcare provider or an experienced clinician. Now let's get into the details of how a ketogenic diet for epilepsy could apply to a beneficial effect on mental health. First, we'll hear from Dr. Chris Palmer, a Harvard psychiatrist and metabolic psychiatry pioneer who authored the book Brain Energy.
Although a lot of people know the ketogenic diet as a weight loss diet or a fad diet, or and some have even heard it's a dangerous diet, it turns out that the ketogenic diet and that term was actually developed by a physician. In 1921 was when they first published the case. And it was developed not as a weight loss diet and not even as a diabetes treatment. It was developed for a brain disorder, epilepsy. And it was based on the observation, a millennial old observation, that fasting can stop seizures. The problem with fasting is that if you do it too long, you starve to death, and that's not very effective. And if you do it just for a few days and the seizures stop, as soon as the person starts eating again, the seizures usually come right back. And so it was Dr. Russell Wilder who developed the ketogenic diet with one and only one goal, to see if he could somehow trick the body into thinking that it was fasting, but provide enough nutrition for people to not be in starvation, and also for people to grow and thrive and everything else that they need to do, because this intervention was being used in children frequently. And lo and behold, he was right. It was successful. It ended up stopping epilepsy in about 50% of the people who tried it, and it helped another 35% of people. It reduced their symptoms. So it was not a panacea. It didn't work for 100% of people, but it was a highly effective intervention in the treatment of epilepsy. The reason that's so important to psychiatry is because we use epilepsy treatments in psychiatry every day in tens of millions of people. Medications like Depakote, Tegretol, Lamictal, Topamax, Neurontin or gabapentin, Valium, Klonopin, Xanax. Most people know those names as medications that are used in psychiatry or mental health, but in fact, those are all epilepsy treatments, and most of them were actually developed for the specific purpose of stopping seizures. And then we borrow them in psychiatry. So given that the ketogenic diet is effective at stopping seizures, it's actually kind of a no-brainer that it might also be helpful to people with mental disorders. And then when you do a deep dive into the neuroscience, we've got decades of neuroscience research documenting how and why this diet stops seizures. It changes neurotransmitters and calcium channels and gene expression, inflammation, the gut microbiome, all sorts of things. And we actually know that all of those play a direct role in people with mental disorders. And so in many ways, it's a match made in heaven.
That's such a fundamental concept about the overlap between seizure medications and psychiatric medications. This strongly suggests shared mechanisms if the same medicine can work for either condition. Now, it's not proof, but this is how research starts, right? You recognize a connection, form a hypothesis, and then design experiments to test it. And those experiments are currently ongoing with 5 pilot trials funded by the Bazooki Brain Research Fund to this date. And likely more on the way. But what about the patients looking for help now who can't wait for the research to be done, right? They're looking for a solution today. And this is where clinical experiences such as Dr. Palmer's or Dr. Georgia Ede or Dr. Shivani Sethi and others are so important for helping people. But I still find it fascinating to explore the potential mechanisms and how nutritional ketosis works for seizures and how those mechanisms may apply to mental health. So next we'll hear from Dr. Julie Milder, who has a PhD in neuroscience focusing on keto diets and epilepsy. She's worked in the field of epilepsy for years and now has joined the Bazooki Group as the Associate Science Director to help further the science of metabolic therapy for mental health. Let's hear from Julie.
The ketogenic diet has been used in epilepsy for over 100 years now. And I think there's a lot of hypotheses that have been generated in its use in epilepsy. We do know that epilepsy being a disorder primarily of too much excitation, glutamate feeding that excitation, and glucose feeding the production of glutamate, there is a lot of reason to think that simply decreasing the availability of glucose in the brain would decrease the propensity for seizure activity. And I think that having learned over time that the brain can utilize alternative fuels such as ketones is really important. The dogma that you need glucose to feed the brain was something that needed to be overcome to think about the mechanisms by which the ketogenic diet works. So now we know quite a lot that ketogenic diet impacts mitochondrial function, improves mitochondrial biogenesis, so you actually have more mitochondria in a ketogenic brain than in a standard glucose-fed brain. And by increasing that biodynamic availability of the mitochondria, you might be better equipped to handle oxidative stress, reactive oxygen species, and other things that might be deleterious to brain activity. And so I think a lot of that, even though we don't know the one thing, because it's probably not one thing, that the ketogenic diet does to decrease convulsant activity in the brain. It's probably a lot of things. The things that we do know, I think, translate very well into other neurological disorders, such as mental health, because a lot of these things we now know are or have demonstrated defects in these regulatory systems and the energy in the brain. So everything goes through the mitochondria and antioxidant capacity and impacts your neurotransmitter systems. And so even though I think we know a lot about what it does in the brain, it's probably going to be different mechanisms that are at play when you look at anticonvulsant activity or things like mood. But knowing that the ketogenic diet does improve the overall state of the brain and brain health and its ability to handle stress and change, I think is a good place to start in looking at its impacts on mental health.
Now, it's so interesting how the effect of glutamate and GABA can change the excitability of brain cells and decrease overexcitability, which could be contributing to seizures and to symptoms of mental illness. And simply changing the fuel of the brain can allow the brain to handle oxidative stress better. So it's not just one mechanism. It's a combination of oxidation, reaction oxygen species, neurotransmitters, overexcitability, and more. You can see how it adds up. So this brings up an interesting question. Is it the ketones themselves, or does it have to do with therapeutic nutritional ketosis and changing the entire diet? This is an important question because now we have available ketones that you can drink, so-called exogenous ketones. And experts like Dr. Dominic D'Agostino, Dr. Ken Ford, and others are studying the effects of supplementing with exogenous ketones. But let's hear what Dr. Milder has to say about exogenous ketones versus a ketogenic diet.
One of the big questions in ketogenic diet therapy is, are the ketones enough? Is the ketone sufficient to produce the effect that we are looking for in terms of treatment, symptomatic benefit, etc.? And it's just not that simple, I think. I think absolutely ketones provide benefit. There are some good studies out there that show that providing ketones alone can change brain activity. However, I believe that it is more holistic than that. I think you can get some of the benefit from exogenous ketones. However, I do think that overall changing the brain and body metabolism has a greater effect. And so, which is why if you look at even epilepsy as the paradigm over the last 100 years for ketogenic therapy, we still haven't gotten to a place where we only supply ketones in order to treat epilepsy. It's still the diet that is prescribed, and I think there's a reason for that. And that is that it's probably both. So there are benefits to ketones. I think there are greater benefits to the diet as a whole.
So as Dr. Milder said, it seems, as best we know, that nutritional ketosis is likely more effective than just taking exogenous ketones. But this research is ongoing, and we'll need more research to help better define that with more certainty. But part of the problem is that doctors typically only consider starting a keto diet after someone has failed multiple medications. And this is frustrating for those who work in the field of metabolic health or ketogenic diets, those who would consider nutrition interventions as first-line therapy. So let's hear from registered dietitian and ketogenic expert Beth Zupek-Kania.
Yes, there are so many similarities, and I can't help but compare the two. And most similarly are that epilepsy, like mental health disorders, in many cases, in epilepsy, it's at least 30% of cases, medications don't help. And I think it's even more for mood disorders. But this is when diet therapy is considered. After the failure of 2 drugs to control someone's seizures, this is the time we think about keto. And oftentimes I work with people who have tried all available medications. Now there's probably a dozen of them. And then they are told about keto, which is really unfortunate because for many of those people, they could have gotten improvement with diet much earlier. And so that's one similarity, is that the failure of traditional medications to make a difference. And it's really sad to see people have to try weeks and months of getting up to a good dose of a medication, a so-called, optimal dose of a medication to see whether it works or not. And then he started on another medication and then, start suffering some adverse side effects from the two of those combined, on and on. It's really breaks my heart to see that happen when people could be told that there is a diet therapy that could mitigate their seizures, again, after the failure of two medications. Because what we know scientifically, and this has been proven for many, many years, is that each subsequent medication has an even lesser chance of impacting those seizures. And I feel the same thing might be true for psychiatric disorders. Like it's, like you're batting your head against the wall trying a new medication because it's not working. And we should step back and reevaluate that this may be a metabolic-based condition, like we're realizing with epilepsy and many other neurological disorders, that we have to start thinking about this as a metabolic condition, and what drives your metabolism, the food that you eat, affects your metabolism, as we well know with keto.
This brings up the natural question of, why not try nutritional intervention and medications together? Why does it have to be a stepwise approach? Again, let's hear from Beth.
I absolutely am, and I'm bored with that concept, and I think patients would be too. If patients realize that psychiatric medications have adverse effects, and they're not always told this until they experience them, but if they were given an option, I think many of them, the majority of them, would try out a diet therapy, and it might be just a very simple, not even ketogenic diet, but a sugar-free whole foods diet, because we often see some improvement just taking that step.
But don't worry, it's not all bad news. The field has changed dramatically since Beth started, and although some frustrations clearly remain, she sees hope and encouragement. So here she is again.
Well, I have to say the change has been slow, really slow, and I'm so happy to see the number of randomized controlled trials that are going on right now for psychiatric conditions, because that is going to speed up the change even more. But I have to tell you that the frustration, again, here I'm using the word frustration, is that there are now 13 randomized controlled trials in ketogenic metabolic therapy for epilepsy, and still to this day, it is not considered a standard of care for people that fail 2 or more medications. And that's really sad, and just a poor commentary on our healthcare system.
All right, so we've detailed the strong connection between epilepsy and mental health therapies with multiple potential mechanisms. We've also explored some promising changes with nutritional therapies and some residual frustrations. But here's a key question. What type of ketogenic diet are we even talking about? The original experience in epilepsy patients was with what's called a 4-to-1 ketogenic diet, which means there's 4 grams of fat for every 1 gram of protein and carbohydrates combined. That ends up being a pretty low protein, very low carbohydrate, and very high fat diet. This is quite different from the modern, more flexible keto diet, which is more of like a 2-to-1 or even a 1-to-1 ratio. Many people are familiar with macro percentages. So as examples, that could be a 5% carbs, 30% protein, 65% fat, or 5% carbs, 20% protein, 75% fat, or even for some thinner, more active people, 10% carbs, 25% protein, 65% fat, and multiple variations in between. But that fits sort of the more modern keto diet. So let's hear from Dr. Julie Milder again about how she sees the difference in these diets.
So the type of ketogenic diet that traditionally was used in epilepsy was a very high fat, right? 4-to-1 fat to non-fat ratio. And I think that where that comes from, it's important for people to remember that it was designed to mimic complete fasting. So the idea that they had seen children who were fasted have relief from seizures, but they wanted to feed them. And so the best way to do that was to go high fat, and the brain was like, then goes only to fat stores as its resource. And so I think that over time, obviously, we have learned that it's much more flexible than that. And I do think it's going to be an individual effect. I think some people will go into ketosis and see great benefit with a more balanced version of a ketogenic diet than going strictly high fat. And even in epilepsy, once kids respond, if they are responding to a 4-to-1 ratio, once they've done well, they'll start to pull back on that ratio and say, oh, can we reintroduce a little more protein or even a little more carb to still keep them in ketosis and see if they maintain their seizure control. And many do. And so I do think that, and in adults, I'll add, they don't go 4-to-1 with epilepsy. They start with a modified Atkins diet for many, many reasons. And they do quite well. And so I do think it's going to be both syndrome specific. What symptoms are we trying to address and get an effect in the brain? It'll be different probably based on what we're looking to change, and also individuals. So how that individual responds. So I do think that there's not one ketogenic diet that's good for everybody.
So one essential topic in this discussion is the issue of protein. How much protein, right? When I initially interviewed dietitian and keto expert Denise Potter about common mistakes she sees when someone starts a keto diet, she mentioned people frequently eat too much protein. Now, I'm a big proponent of getting adequate protein, so that definitely raised my ears, and I wanted to hear more. And after talking to her more, I realized terms like too much, high, or low, they're all relative terms, right? So I had to ask her directly how she factors in protein when helping her clients start a ketogenic diet. Does she recommend more of a 4-to-1 diet, very low protein, or a more modern, flexible keto diet? So let's hear what Denise had to say.
Okay, so I'm going to go back a step on you. So the 4-to-1 ketogenic diet, which is what we call a classic ketogenic diet, which we use a lot in epilepsy. And I'll say when I started 15 years ago, I did put most patients, children, on a 4-to-1 classic ketogenic diet. If I only knew then what I know now. Then over the years, we started saying, wow, the tide just kind of slowly started turning. We thought, wow, they're almost sick on that 4-to-1, which is, it's not technically low protein. We always make sure we give adequate protein to meet the RDA for protein. But it's way lower than most people eat. So that's where we think of it as low. Anyway, so we realized, wow, there are studies that say these kids could do just as well on a 3-to-1, which means 3 parts fat to 1 part protein and carb. So, or 1 grams of each. Anyway, so we started doing that. And then I thought, wow, well, maybe they could do just as well on a 2-to-1. And so the trend over the last, 5 to 10 years has been, just like medication, you don't just say, here's the highest dose of Keppra, take it, right? You start and you titrate up and you give according to weight. And so we do that. And so even now, 4-to-1 in a lot of epilepsy programs is very limited, use much, much less. We use it more commonly if we're using a formula. If someone's on a tube feeding, they don't care. We might as well just, it's not a problem to give them the higher dose. So with an adult, a 4-to-1 is entirely too high for most adults because they can't get enough protein on that. That percentage is 90% fat. And if you do the math, it will come up and say, oh, you get negative carbohydrate because you just can't meet the RDA for protein. I've had a couple people of their own, and one person specifically who had bipolar, he had himself on a 4-to-1 diet, and he kind of comes to me just for consults every now and then. And I'm like, wow, I don't really think you need to be on a 4-to-1, but he was eating 3,600 calories a day. At 3,600 calories, he could tolerate a 4-to-1 because now that percentage allowed him enough protein. He's since over the years come down and is on, a 2.5-to-1, I think now, or even a 2-to-1 last time we spoke. But that high level is virtually unsafe for adults. And it's really, it's virtually unsustainable. It's just very difficult to do. I have occasionally a cancer patient who, they wiggle the numbers and we can get them enough protein on a 3-to-1 sometimes if their calorie needs are on the higher end, but someone who's on the low end calorie need, you can't get the protein in and we just won't do it.
As you can see, when she talks about too much protein, she still wants to make sure that her clients get adequate protein. And that is so essential for long-term strength, lean muscle mass, bone health, and probably even for improved satiety and metabolic health. So it's crucial to understand that the RDA, the recommended dietary allowance of protein, is the floor. That's the minimum people should eat at 0.8 grams per kilogram of reference body weight. Now, reference body weight also sometimes called ideal body weight, is based on your height. And we'll link to a description below that goes over the details. So the RDA is the minimum, but good science suggests that you want to eat around 1.6 grams per kilogram of reference body weight, so twice the RDA, for optimal body composition and strength, with the elderly and more physically active individuals requiring even more. But as we heard from Denise, she'll usually start at about 1.0 to 1.2 grams per kilogram, allowing people to get adequate protein, be happy with their diet, and ensure that almost everybody achieves nutritional ketosis. But this is where individualization can come in, and monitoring ketones can be really helpful. If someone is more physically active and more interested in strength and body mass, well, maybe they want to eat more protein, but should be monitoring their ketones to make sure they're still achieving adequate ketosis. And working with an expert like Denise or Beth or some of the other people we've featured in our videos can be so important. Now, a quick aside, when it comes to testing ketones, I usually recommend finger sticks. I usually don't recommend urine strips, as they're kind of the least accurate. But again, it shows how important it is to work with an expert and individualization, because it's not just about getting ketones. It's about getting the appropriate level of ketones for you while making sure you're also getting the right amount of protein and other nutrients. So now that you know all about this connection between ketosis for seizures and mental health, and you heard some professional tips on the type of ketogenic diet you can start with, I want to tell you about our next video, where we're going to go over some more expert tips about what you can do or not do when getting started with a ketogenic diet to sort of help you ease your transition and help you get started. So if you've already started or you're thinking about starting nutritional ketosis, you may want to check out the next video with more expert interviews and essential tips for you to ensure an easier transition. And as always, if you found this video helpful, please click the thumbs up and subscribe buttons, and make sure to share this video with your family and friends and healthcare providers so you can help spread our message to help as many people as possible. And please leave a comment. We'd love to interact with you and hear what you found most helpful from this video. So thank you so much for watching. Please have a great day and take care of yourself, take care of others, and we'll see you here next time at Metabolic Mind.